Well, welcome everyone. Thank you so much, Marissa, for the introduction. Ariana and I are so excited to talk to you today about the power of youth health advocacy and the importance of youth health advocacy when it comes to HPV vaccine education and awareness, and more broadly, the prevention of HPV related disease. As Marissa mentioned, we are from the Global Initiative Against HPV and Cervical Cancer, GIAC for short, Young Leaders Program. And so we're excited to share with you some of what we've learned about how to get youth involved in these really important causes. And then later on to share more with you about a really awesome project that we've been working on over the past year in collaboration with Women Empowering Nations. So without further ado, Marissa gave us a great introduction, so I think we can keep moving on.
I was going to say, I'll take over from here. So GAIAC was founded in 2010, and GAIAC works towards raising HPV awareness and eliminating cervical cancer through education and empowerment of international stakeholders. GAIAC is a vocal advocate for vaccination against HPV, screening, and expanded access to early treatment with the aim of making cervical cancer a disease of the past. And I also wanted to say our GAIAC Young Leaders program was actually founded by a young leader herself who was helping Dr. Krishna in India. So it's pretty cool how our Young Leaders program was initiated from a young leader. And here we are today with about 20 to 30 volunteers.
So here we just have a couple fast facts about HPV and cervical cancer. I'm going to breeze by this because I know a lot of us are very familiar with this information. But what I want to emphasize most importantly here are these key strategies for HPV and cervical cancer prevention. Most of us are probably familiar with the three pillars of the WHO cervical cancer elimination. I don't know what's drawing on the screen. The three pillars of the WHO cervical cancer elimination goal, which are, of course, vaccination, routine screening and early detection, and then care for women who have either precancer or have already developed invasive cancer. And especially when it comes to HPV vaccination and routine screening and early detection, these are areas where young people can be really, really powerful advocates for awareness about the importance of these prevention methods and helping their peers and other individuals in their community understand how to access this really important care.
I'm going to have you meet our team. So the GAIAC Young Leaders Program is a youth-led initiative under GAIAC. Our Young Leaders Program provides a global platform for students of all genders who engage and help fulfill GAIAC's mission through six different areas. And you can kind of see them listed at the bottom. The first one, social media. Next, we have outreach committee, scientific committee, public health and advocacy, fundraising, and I forgot to include arts, but we do have an arts committee who's looking for an arts committee leader. Okay, so all of these committees work on a variety of projects throughout the year, many of which center around International Days of Action. As you can kind of see, I screenshotted some of those days in which we celebrated. So all the way to the left, you see in September 2024, GAIAC was honored to be recognized during the United Nations General Assembly of being part of the Quad Cancer Moonshot team. And then right next to that, you'll see like a GAIAC Akelta launches Egg a Day screenshot. We did this in November 2024. The GAIAC Young Leaders partnered with Akelta Foundation to launch the Egg a Day fundraiser. And this is where we provide nutritional support to women in Rwanda at risk for cervical cancer. With 75% of diagnosed women not surviving, the initiative helped to donate 1,000 eggs to support these women undergoing treatment. All the way to the right, not the picture in the middle, but the one next to it. This was this year in April. McKenna and we got invited to the National HPV conference. So our young leaders, her and I, helped to lead a workshop there at the first ever National HPV conference, helping to further youth-driven advocacy in HPV and cervical cancer. And then we're going to look all the way to the right, and that was in June of 2025. And I think Marissa kind of touched on some of this, but GAIAC helped to launch a new series of HPV vaccination education videos for patients. These videos were premiered during the second Global Cervical Cancer Elimination in Bali, Indonesia. And finally, we're going to go back to the screenshot in the center. It's kind of cut off, but it says Us versus HPV Week. This is held in January of every year. This is like our huge event where it's a webinar series that discusses HPV related cancers and diseases. Specifically, Friday is when we have our youth advocates come in and share projects that they're doing in their community.
So, Friday of Us versus HPV, as Ariana just mentioned, is dedicated to amplifying youth voices. And that's, of course, an opportunity for young people to showcase their work to our international webinar audience. But it's also a crucial opportunity for them to be able to share their work with their peers. So, we know that young people are influenced by their peers, and having a chance to share their research or their advocacy through a platform like Us versus HPV shows other young people what's possible and can really inspire them to get involved in HPV advocacy or just general health advocacy of their own. And peer-to-peer engagement is also so important when it comes to sharing health information. So when it comes to HPV related education for youth, other young people are really some of the best and most effective messengers. And that's why, in addition to giving young people formal platforms where they can connect with their peers, like the Us versus HPV Friday Youth Day, or attending conferences like the National HPV Conference, like Ariana and I did this year, um, we make sure that youth are really the faces of our campaigns. For example, our International HPV Awareness Day campaign, which is screenshotted here. And this was a campaign where our young leaders strung together videos of themselves sharing HPV facts and shared it to social media. And this had a really broad reach. And social media in general is an area where youth can have a really huge impact, which is something we're going to dive into a little bit more later.
Oh, we can't see the picture, but so by combining youth-led initiatives with the reach of social media, we can engage even more young people in the conversation and help to inspire action on a global scale. So as we've heard, through the social media landscape, it's incredibly important when it comes to HPV related information, and young people are uniquely poised because they are, of course, always on social media, and they're usually most tech savvy of all of us. So, as you can kind of see on the right, the Women Deliver Conference in 2019, one of our middle school young leaders helped to design a flyer for the cervical cancer campaign in New York City. Well, I guess you can't kind of see right now, but she didn't only do that, but she also helped to create a YouTube video for it as well. And also for Cervical Cancer Awareness Month, high school young leader used the power of dance medicine performance to bring a patient's voice to life through movement and storytelling. So this powerful performance was captured and shared on YouTube, allowing the message to resonate with people far beyond the event itself. So these are just examples of how utilizing digital platforms can help empower young people to become advocates in their communities and turn their creativity into a force of change.
So, another really impactful strategy for youth advocacy is interactive events. Outreach specifically is a huge part of GAIAC Young Leaders' mission, and our young leaders go out and give age-appropriate outreach presentations about HPV and HPV-related cancers to schools and community organizations. And we have presentations that are directed towards elementary schoolers all the way up to medical students to educate young people about HPV and equip them with the information that they need to make decisions about their own health and to go out and advocate for their peers as well. Of course, that's only one example of interactive educational events. Another example from our work this past year, like Ariana mentioned, was sending a high school HPV advocate to the White House for Healthy Girls, Healthy Women 2024, which is an event that's part of the Biden Cancer Moonshot program. And this was an opportunity for her to practice her advocacy skills and meet other teens that are passionate about this work of HPV prevention. And there are so many other examples of interactive events that young people can lead, like fundraisers, trivia events, workshops. Really, the list is endless, and young people are so creative about the kinds of events that their peers and communities will be receptive to, which is something we're also going to hear more about when we dive into our youth community health advocacy program called REACH in a little bit later in this presentation. So now we've talked about some examples of our work and more importantly, why youth can be such effective HPV advocates or HPV prevention advocates. But now, of course, the next question is how do we get youth involved in this work? And that's really the meat of what we're here to talk about today. So there are really two main ways of doing this that we want to focus on. The first is by creating opportunities for youth within the work that you are already doing. So that might look like creating volunteer opportunities or internships or youth ambassador roles. Having formal titles for these positions, even if the position itself is a bit more informal, is a great incentive to get youth interested and engaged. And you can advertise these opportunities, of course, through social media, but also by directly sharing these opportunities with local schools or youth groups, or posting to websites like Idealist or Volunteer Match, where motivated young people might be looking for opportunities to get involved in advocacy work. It's also really important to mention here that creating roles for youth in your work is really a win-win situation. For all the reasons that we've already discussed, youth can be so impactful when they get involved in this work, and bringing them in also allows them to develop the skills that they need to develop as future leaders in this space. The second way to engage youth is a bit less structured, but it's by offering support or mentoring to motivated young people who already have ideas about how to advocate for HPV prevention in their communities. So at the National HPV Conference, Ariana and I were really inspired to learn about a high schooler implementing her own HPV prevention advocacy program in Oregon. The student's name is Mitali, and she approached the Oregon Night Cancer Institute with really big ideas about HPV related programming that she wanted to lead at her high school. And while everyone was understandably a little bit skeptical at first that a teenager would be able to pull off such an ambitious plan, she was ultimately met with guidance and support for her ideas, which resulted in an incredibly successful program that has since drawn many other motivated high school students to take up the work of advocating for HPV prevention. And these kids aren't only making a difference in their schools, they're learning the skills that they need to continue to be leaders and change makers as they advance through their education and through their careers. So maybe your organization or you as an individual in whatever your professional capacity is hosts a youth outreach event and a young person approaches you about an idea they have for a program at their school. We would just urge you to consider that a lot of these kids will really blow you away with their leadership and creativity, and to consider supporting these efforts when you have the opportunity. So, okay, back to the how. Of course, we all want a student like Mitali knocking on our doors when we want to get youth involved in our missions and in our work. But of course, we know it's not always that straightforward. And we know many people have questions about where to actually find youth and engage and collaborate with. And that's something we want to dive into and discuss briefly as a group. So that leads us to our first discussion here. So, we would love to just hear from anyone here about successes that you've had in the past, either identifying local youth networks, connecting with young people through your work, or how you've harnessed the power of youth advocacy that you've been doing. Alternatively, I saw in the chat that some of the individuals here are youth advocates themselves. So, if any of you also want to share your experiences getting involved, that would be awesome. So please feel free to unmute yourselves or drop in the chat any experiences that you've had.
If I could jump in. So this is a little different from how we've done things in the past. So we're really excited to integrate the discussion section into the presentation. I think this is a great idea from the GAIAC team. So would love to hear from our partners on some of these questions that the leaders have put together, and then they'll continue presenting, and then we'll come back to some discussion. So let us know if you've what your experiences look like. Like I said, we know that engaging youth leaders has really been something that's come to the forefront of the discussion, especially at the event that I was just at in Bali. And it was great to see some young leaders from UNICEF's ambassador program come and present from that perspective. But what I love here is the tangible examples that McKenna and Ariana are giving us for where they've seen success, some real examples. So thank you so much for kind of really conceptualizing it for us, and not just talking about concepts, but really how those successes have worked thus far for you all. So please feel free to drop something in the chat, or you can raise your hand and we'll call on you to engage as well. Or if you have a question for the group so far, we're also happy to answer those.
Yeah, and if Ariana and I can also get started off a little bit with how we've done this in the past. So I think sometimes knowing where to go to find young people to work with can be a little bit difficult. it's great when people, reach out to you specifically to fill internships or volunteer roles. But in terms of actually going out and doing outreach, we've found it works really well to work with school-based organizations. A lot of colleges and medical schools have clubs that are interested in health advocacy or even HPV and cervical cancer specifically. And that can be a great pool of really motivated young people who are interested in finding work to get involved in this space. It can also be really helpful to, like we said, post on social media. That's where a lot of young people are, and a lot of people are looking for opportunities to get involved through social media. So that can be a really powerful tool as well in order to recruit people into your mission who can help really amplify the work that you're doing.
I also want to add to that. A lot of people mentioned too, I remember at the National HPV conference, and I hate to say it, but a lot of young people are looking for like mentorship or volunteer hours. Maybe put in an idea, it's like a shadowing opportunity or something you can provide to them as well. Obviously, the opportunity itself is amazing, but like, people, if you put it a certain way, a lot of young people are looking for that. And that's kind of how they get started. And then they're like, 'cause sometimes they don't know about it right away. And then once they do it, they're like, oh my God, they learn more, they become more passionate. So those are just ways to kind of like pose the idea and then get them interested and get the youth involved. So.
Yeah, and that comes back to the concept we touched on of really formalizing these roles. Having instead of can you come volunteer for 5 hours a week, have it be, referred to as a fellowship or an internship. Not only because that draws people to fill that role, but because that's something that's really going to help those individuals in their next steps in their career as they go on to higher education or other next steps in their career. It's really helpful for them to not only develop those skills, but have a concrete experience that they can talk about that they've been involved in, which will help them with their next steps. And like we said, it's really important that these are reciprocal. So that's something that one way that you can do that, especially if these opportunities are not going to be paid, which obviously a lot of us are not able to provide financial compensation for the young people working with us. So having something tangible that is going to help move them forward in the future is a great way to have a reciprocal relationship with the youth that you're working with. And I
Oh, I
can't
think
I can't see the
I think
chat
we did get a
part.
question.
Okay.
Yeah, the first one says, what support do you provide to a young leader if someone wants to volunteer to advocate HPV related cancer?
Yeah, so I think that's where a lot of our educational materials come in. We spend a lot of time on HPV education before we bring anyone into our outreach efforts. We really believe that the foundation to good advocacy is solid information and a really deep understanding of the issue that you're planning to advocate for. So when we bring people in, first and foremost, we're educating them about HPV, we're educating them about cervical cancer, other HPV related disease. And then we also want to provide people with a really solid foundation in terms of their advocacy skills. Like, how do you identify this information that you're going to be sharing with your community? What strategies can you actually use when you go out and share this? How do you talk to other people about misinformation? And a lot of those skills are things that we ended up rolling into our REACH program that we're going to talk about later. So I think that we will get even more in depth into the kind of specifics of how to do that in just a little bit.
And then it looks like Monica asked, which outlets do you use most on social media to reach young audiences? So I can speak on this, McKenna, if that's okay.
Yeah, of course.
Um, so I will say I noticed like LinkedIn, I get the most reactions. You gain followers so quick on there. But I feel like that's usually for a more experienced audience. So I wouldn't say LinkedIn for young people. Definitely Instagram or Facebook, TikTok, of course. I think actually TikTok would be number one, then Instagram, and then Facebook. Facebook is kind of I don't know, young people are still there, but not as much. And also posting reels, videos, those gain the most views, those gain the most followers, the most traction. So those, I would say TikTok, Instagram, then Facebook in that order, is where you can reach the most young people. And then I think we had Sid. Oh, Siddharth is here. He said, hello, everyone. My name is Siddharth, and I'm a rising high school senior from Maryland. I was just at Capitol Hill in June as a youth advocate for the Prevent HPV Cancers Act and found the experience really fruitful. For the most part, having the most having the opportunity to go to the Congress and meet representatives gave me a foundational, unique experience that I'll remember for the rest of my higher education. And Siddharth is a Gaiak young leader, so he was just there with Dr. Krishna.
Yeah, and something else that I'll mention, just stepping back briefly to the social media platforms, Ariana, is that
Mhm.
if you're able to connect with any influencers in your community and
Mhm.
have them help amplify your message, that's an awesome way to reach young people. In my previous work before medical school, I worked for a cervical cancer prevention nonprofit. And we worked with a lot of influencers trying to kind of get the message out about the screening events that our organization was hosting, the importance of screening, the importance of vaccination. And a lot of these people, influencers typically, as some of us may know, will take on paid advertising, promotional
Mhm.
deals in order to share information. But in a way, it's almost like a donation as an organization that's doing community health advocacy to ask them to post about these issues or post about an opportunity that you're sharing. And we found a lot of individuals were very receptive to kind of donating their influence to our cause. So that's something you can consider as well that we found to be really effective at getting our message out to a broader audience. For those of us who ourselves are not, overflowing with followers on social media.
And I
Um,
guess that real quick too, you're right. What kind of goes with that too is like co-creating with other organizations. So like us at Sabin, us with Women Empowering Nations, like, that's how other people hear about you and that's how you can bring in a lot of followers. So that was a good idea, McKenna.
And there's one more question in the chat from Danny, and they ask, does your advocacy program only emphasize enriching knowledge about HPV, or does it encourage vaccination among young people too?
Yeah, we absolutely encourage vaccination. I think that the core idea behind increasing young people's knowledge about these issues is not only that they're going to go out and be advocates, but also that they're going to be empowered with the information they need to make decisions about their own health. So we hope that individuals walk away from whatever training they've received from us, whether it's HPV related or cervical cancer related, or general health advocacy training, knowing how to find information that they can not only share with their community to improve community health, but that they can act on to be their healthiest self as well. So that, yeah, that's something that's super, super important to us. Okay, well, with that, thank you guys for your input in the chat, and we will keep moving.
Okay, so we've stressed the importance of how to get youth involved. We discuss how to get them. Now we're going to discuss on advocacy work that they can be really impactful in. So we know that there are three main barriers, and they are as follows: lack of information about the HPV vaccine, myths, misconceptions, and stigmas about the HPV vaccine, and finally, vaccine access. However, I really want to emphasize the first two bullet points in which youth can get involved.
So, as Ariana mentioned, misinformation, mistrust, and a lack of education are two of the biggest barriers to HPV vaccination. And these are the barriers that youth can really help us overcome. One example of that is social media, because young people, as we've been saying, are increasingly getting their information on social media these days. And as we all know, a large portion of that information is unfortunately misinformation or disinformation. So, I won't read you all of these comments here, but these are just a few videos and comments that Ariana and I found from a really brief search of the term HPV on TikTok. These comments are expressing a lot of mistrust in the medical system, and include a lot of examples of misinformation as well, especially about vaccine efficacy or vaccine side effects. Some of these are also trying to sell you something, but that's a whole other side of the health misinformation rabbit hole that we won't go down right now. But what matters here is that if I go on TikTok, as a lot of people do, to look for information about HPV or the HPV vaccine, this information might influence how I feel about being vaccinated or about getting my child vaccinated, because a lot of parents are actually using social media as a source of information as well. But the good news here is that social media can also be a tool for good as much as it can be a place where misinformation spreads. This example here, we have a video of a young woman who's sharing that she just got her second dose of her HPV vaccine. And in the caption, that I don't expect you guys to necessarily be able to read, I know it's a little small, she explains that she's happy to be reducing her cancer risk essentially by getting vaccinated. And this is a great example of using social media for peer-to-peer education to promote the HPV vaccine. And this is only one example of the kind of social media content that we can support and encourage young people to make that can have a real impact on our HPV vaccination rates. Overall, more generally, to bring youth into the fight to increase HPV vaccination rates, we really need to empower them, as we mentioned during the discussion, with factual, easy to understand information that can shape their understanding about HPV and HPV vaccination, and that they can share with their peers, their parents, and their communities, and that they themselves can act on when they make their own health decisions. We really need to provide safe, open spaces for discussion because young people want to talk to each other. They want to know what their peers are thinking. And in that same vein, we need to harness the power of peer-to-peer outreach and education efforts, like the outreach we do here at GAIAC Young Leaders, as one example, and the outreach that our incredible Reach leaders, who we're about to discuss a bit more, are about to do soon, as ways to both spread awareness among young people about HPV and HPV related diseases, and really to get young people thinking about how they can get involved in advocacy and really find their voices and be leaders in making their communities healthier. So that brings us to our next discussion point, which is that we would just love to hear from all of you. Obviously, the barriers that we mentioned apply across a lot of different geographical and cultural contexts, but the way that these barriers impact young people can differ pretty greatly between different communities. So we would love to hear from you guys how these barriers of education, safety concerns, or vaccine access impact youth in your communities and how you might be able to empower the youth in your communities to help really reduce these barriers. So feel free to come off mute to share or to just drop in the chat what you've seen in your own community.
And something, if I could jump in and say, while some of the partners might be thinking or typing, something that became really clear at a lot of the meetings that I get to attend is that a lot of the barriers and challenges, it's so interesting how, regardless of whether you're neighbors or two countries across the world, there's so many similarities in the barriers that everyone, that youth are facing. And I think it's great that you really promote that peer-to-peer learning approach to the work because instead of reinventing the wheel over and over again, we can really learn from one another on how to mitigate some of those challenges and, avoid some of the things that keep us from finding success a little more easily when we can learn from each other. So we try to do that a lot at Sabin, and it's awesome to see the work that you all do in that space as well. But would love to hear from some of the partners on the call, either in the chat or raise your hand about, what you see in your communities. What do you feel are the biggest barriers impacting youth, or how you've successfully engaged and empowered youth to reduce those barriers? And I know a lot of us on the call have been in different positions of mentorship in the past. And as the GAIAC team mentioned, that's also a really key piece to all of this. So if you've had an experience with mentorship that you'd like to share, or I would love to hear more about that as well. So let us know. Yeah, Sophia.
Hi everyone. Sorry, my signal isn't great, so I'll keep my camera off. Hopefully that you can all can hear me pretty well. But
Yes.
coming to you from the Access Challenge, I'm their global fellow for the summer. So representing the organization on behalf of Assad, if you all are familiar with him. But our work is primarily focused in East and Western Africa, and just coming here to say I think this knowledge is really helpful and obviously applicable, just as you mentioned, Marissa, from both here in the US and across the globe. And a huge part of our 2025 to 2030 strategy is really going to be focusing on this youth empowerment aspect in our program, specifically in Tanzania. And we've really put an emphasis on the education aspect. That is really our whole mission at this organization is about message shifts and really, social and behavioral change around global health concerns. So this kind of structure of peer-to-peer engagement is exactly what we're looking to do. And I think having the age-appropriate kind of materials, et cetera, is also very helpful to see because I think that's something we work with adults a lot of the time. So thinking about how to shift that messaging slightly and make it more relevant to youth as this becomes one of our top priorities. That's one of our big focus points. So just chiming in to add that as well.
Yeah, thank you, Sophia. That sounds like a really, really cool project. And I think when you're developing those age-appropriate materials too, sometimes with that, it isn't always our first thought to let the youth that we're working with be the ones leading that development. But a lot of times when Ariana and I have done that in the past, just had young people come to us with like, what would you want to see if this was a flyer being handed out, or how would you prefer this information to be presented? They come up with things that we just would have never thought of as ways to share this information with their peers specifically, and the things that would be engaging to their peers. And then when they actually go out and share this information, their peers aren't just like, oh, who's this, older person droning on at me about something that maybe I don't care about right now. And they're
Mhm.
really able to have that deeper connection that ultimately leads to everyone being a lot more engaged. So best of luck with that project. It sounds really, really cool.
Thank you. And yeah, that's a great point because we're really going to be focusing on vaccine campaigns in schools as well. So very much so, I'll bring that back to the team. So thank you guys.
Thank you.
Absolutely. And then I'm seeing here in the chat, so someone mentioned in our community, young girls do not always have social media access, especially if they're young and live in remote areas in Bangladesh. So they lack knowledge, and in-person advocacy is the most important way to educate them. And yeah, I think that goes back to just the most important tenet of community health advocacy, which is being responsive to the needs of the people that you are working with, or trying to raise awareness among. Obviously, a social media campaign is not going to work in your community. And I think that it's so important to understand the best methods of communication to get the information that you're trying to share with the people who really need it. And
And I
then
feel like McKenna too that sorry. I think we're gonna have one of our Reach Health Advocates later kind of speak on something she's gonna do in her community where she's gonna probably likely lead a peer-led initiative. So that'd be something to listen to. But we found that in our Reach program that that problem specifically, lack of social media access, was very prevalent. And then they were doing kind of what Sophia mentioned, they're wanting to lead initiatives like going to the schools, going to their community, like marketplace, wherever it may be, to help go against that stigma and promote more HPV awareness.
yeah, and that speaks to Betty's question, which are what are some of the differences and similarities you see in advocacy approaches across different geographies? And I think that, like we mentioned, methods of communication,
Mm.
the kinds of channels you're using to reach young people, also the content and messaging. We had extensive discussions with our recent Reach cohort. I know we keep mentioning Reach. I promise we will explain more about it very shortly. But we had really extensive discussions with the girls about what the barriers in their communities were, and a lot of stigma differed culturally or religiously, or based on different religious beliefs in different areas, different methods of outreach that would need to be employed for their programs to be successful. So I think that the broad categories of barriers are very similar across geographies, but in terms of what specific misinformation you're combating, what specific information needs to be shared, and how that information needs to be shared, I think that those approaches are as diverse as the different communities where they're going to be implemented. And then Dr. Krishnan mentioned that while youth education and engagement is so important, we also have to simultaneously educate parents, as many young people cannot make a decision to get vaccinated, which is so true. Mitali, the high school young leader that we mentioned earlier, a big part of her program is actually teaching young people how to talk to their own parents about vaccination decisions, which is really cool. We can share their advocacy toolkit with everyone after this. It's really, really interesting to see what they've put together. The whole toolkit is directed towards initiatives that other high schoolers can implement, but a lot of the expected impact from those activities is really to sway the opinion of parents and community leaders, because you're completely right that sometimes these decisions are not in the hands of the young people who we're educating.
And sometimes, most of the time, actually, you're not always going to change someone's opinion. They usually will have a very biased opinion on it, but if anything, having that conversation so that they know, it's very important. And to like McKenna said, we do at the very end of this presentation have a QR code, and you're going to scan that, and you will find Matali's, I think, outreach of how she discusses attached to that. So.
Yeah.
And we can also share that after the fact as like an after action. So if any partners here want to share some things they've done in this space, we can include that, but would love to have that toolkit. I think that's so important. So we'll share that out after the fact.
Awesome. Well, thank you everyone for your input and discussion, and we will keep moving.
Okay, so key takeaways. So, youth can be powerful advocates for HPV vaccination, helping to overcome barriers like lack of education and misinformation by hosting outreach events, leading educational social media campaigns, acting as peer educators, and much, much more. And of course, your mentorship and support is key to maximizing their impact. So, with that in mind, we like to introduce a program that we developed to support and empower the next generation of youth health advocates. The program is entitled Raising Empowered Advocates for Community Health, REACH for short. It is a collaborative between the GAIAC Young Leaders and Women Empowering Nations. Specifically, we recruit participants from the GLOW Girls Leading Our World Network within Women Empowering Nations. And so here I'll hand it over to Wimboy to share some more information about Women Empowering Nations.
Hello, everyone. My name is Womboy Gashunga. That was such a great conversation with Ken and Ariana. I really enjoyed that. But I'm just kind of here to introduce Women Empowering Nations and talk a little bit more about REACH. So as Marissa mentioned, I'm a third year biomedical engineering student at the University of Florida, and I also have the privilege of serving as a Glow Ambassador for Women Empowering Nation. So I'm really honored to be here today to introduce Women Empowering Nation. WEN was founded by the incredible Carlucia William Bradley, who's also in this meeting today. Her vision and leadership is part of the major reason why this global movement exists and continues to thrive. Next slide, please. Since 2009, Women Empowering Nations has empowered over 16,000 girls across 60 plus countries, from the US, South Africa to Morocco to New Zealand. I think it's a really big reach where the world's leading organizations supporting leadership development, career acceleration, and global exposure for young women. Every pink marker you see here represents kind of ripple of change, young women who are now catalysts for impact in their communities and beyond. Um, slide, the next slide, please. So what exactly do we do at WEN? First, we provide leadership development that's rooted in mental wellness, storytelling, advocacy, and global connection. Talking from experience as part of a cohort member, 2023, when it's just not about building skills, it's about like nurturing whole, confident, and purpose-driven leaders. And then secondly, we build the pipeline of young women leading systems to change, young women who are already redefining what leadership looks like and making bold, lasting impact across the globe. I'll take it back to Ariana to continue.
Yeah, so really quickly, I'd just love to give a little bit of background about how this program came to be. So, as I mentioned earlier, Ariana and I do a lot of outreach work about HPV and HPV related disease through GAIAC. And we were at some point really brainstorming how to refine our training for young people about how to get involved specifically in advocacy around HPV and HPV related disease. And we were connected to Wimboy actually through our mutual partnerships with Sabin. So we have Sabin to thank for this partnership. Um, and we met with Wimboy and we shared this idea that we had for basically an HPV advocacy training for young people. And she really pushed us to think harder about how we could make sure that the girls that we worked with walked away with skills that would help them through their career, their future advocacy work, everything that they're going to do moving forward. And so from there, we kind of expanded the scope of this project to become what it eventually became, which Ariana will explain a little bit more now.
Okay, so kind of like McKenna said, we co-created a program that essentially blends science education, leadership development, and advocacy, and empowering young people to lead real, impactful health initiatives in their specific community. So in doing so, we created a two-part workshop or workshops. The first workshop focused on using HPV and cervical cancer as a case study to guide participants in developing their own community health project. We also introduced core advocacy skills, those being health literacy, science communication, and media literacy and identifying misinformation. And then the second workshop was more interactive, allowing the girls kind of build out and present their projects to us. And then at the end of the program, each participant received a certificate recognizing them as a certified youth health advocate in building out their own outreach project. So with that being said, we'd love to hear from our own Reach Health advocates that are going to be presenting today. The first Reach Health advocate that we have is Labono Sarkar, and I apologize if I messed up your name. Um,
I'm gonna stop sharing so that Labano can share her slide. So each of these three girls is with us today to give a quick 5-minute overview of the community health initiative that they developed through their time as a REACH cohort member and share a little bit about themselves. So
Thank you for having me here today. It's a pleasure to be speaking here. And I'm Labono, and my project is titled Spreading Lady Ganga's Message, which is an initiative towards HPV and cervical cancer awareness. To introduce myself, I'm from Bangladesh. I was born and raised here for most of my life. I am currently a second year undergrad student majoring in public health at the Asian University for Women, which is located in Bangladesh. And I came across the REACH program to Women Empowering Nations, and it seemed like a great opportunity to learn about HPV alongside a group of inspiring women from diverse backgrounds. The problem statement I've come up with is HPV to social, cultural, and religious norms, inequalities, a lack of education, posing HPV related risks to people, especially women of all backgrounds. Therefore, the stigma and misinformation surrounding HPV must be tackled using education and advocacy, particularly among young women who are more vulnerable in society. This will encourage early prevention and raise awareness among younger generations. So here are some recent HPV related statistics in Bangladesh and in the South Asian region. So as you can see, cervical cancer is the second most common cancer among Bangladeshi women. And although these statistics are concerning, it is important to note that recent changes, such as a nationwide vaccination program that began in October 2023, has brought many changes in the HPV or in general women's health scenario in Bangladesh. And in fact, just yesterday, on July 15th, WHO and UNICEF released a set of new data that showed that South Asia has achieved the highest immunization coverage for children. And while these are major milestones, a lot more can be done to improve the state of HPV in Bangladesh. I'll briefly go over my solution and my implementation plan. So my target audience as of now includes the students from my university. And the initial step that I will take to carry out my project is to conduct an online survey that assess students' knowledge on HPV. And by assessing the results of the survey, I can further implement my project, such as by conducting different sessions targeting HPV awareness, recruiting more members to contribute, and expanding my project beyond the university. And here I have listed some strategies for disseminating the project and also potential contributors, which one of them includes one of my professors. And here is an outline of my implementation plan. It follows a week-to-week basis, and as you can see, my goal is to implement it by August 9th, which is Global Give Back Day. Expected impact. So through this project, I hope to impact at least 50 students. And my target that I've set for myself is to increase HPV awareness among young women and to inspire these women to find their voices and contribute to the cause. And the indicator of target achievement, or the indicator that will determine whether or not the target was achieved, is the number of student participation, whether through surveys or the students who get involved in the project later. And some final thoughts. So the next steps to implement project is to reach out to contributors, which I will be working on very soon, and also to continue learning about HPV and its related risks and everything surrounding HPV. And some to conclude, some key takeaways from the REACH program. One of the most important things I learned was how to advocate efficiently. And the reason this was super impactful to me is because I've barely had any experience advocating. And as someone who tends to suffer, this was very important to me. And also being a public health student, that this was professionally and academically enriching, as well as it helping me to improve myself on a personal level. These are some of my sources if anyone's curious. And thank you. I would also like to thank the REACH leaders for giving me this opportunity, and to everyone here for taking your time to listen.
Thank you so much, Labano. That was amazing. We're so excited for your project to be implemented and just so proud of the hard work that you've put into this. So thank you so much for joining today to share. So next we're going to hear from Precious. So we'll have you stop sharing, I think. Let's see. And so when we implemented the REACH program, as Ariana mentioned, HPV and HPV related disease was used as a case study, but the girls all had the option to choose whatever issue was most pressingly impacting their local community. So Precious does not have an HPV related project. It is still really awesome and exciting, and we can't wait for her to share more about it with all of you. So Precious, feel free to please share your slides now.
All right, thank you so much. Hi everyone, I'm Precious Kusomalante anyway from Nigeria, and thank you so much for having me on this meeting. I I studied animal and environmental biology in Nigeria, and I am passionate about community health, environmental sustainability, and user creative communications to drive behavior change. I got to know about the REACH program by and through the Women Empowering Nation, and it has been so helpful throughout its timeline. Thank you so much. So I came up with a problem statement on typhoid, and typhoid is a life-threatening infection caused by Salmonella typhi, and it is primarily transmitted through contaminated food, water, and contaminated environment. These symptoms have been misdiagnosed for malaria frequently, and this has led to misdiagnosis and also antimicrobial resistance because typhoid fever is majorly treated by with antibiotics. So in 2019, Nigeria recorded about 291,909 typhoid cases and 3,584 death cases due to typhoid according to the Global Burden of Disease study. And my target audience towards this project are young adults, parents, and caregivers between the age 18 to 30 in urban and pre-urban areas. As according to this study, it has shown that 89.9% of typhoid cases occurred among people between the age of 0 to 29, which is still between my target audience rate, and it is highly prevalent. It's slightly highly prevalent in females compared to males. So I am targeting people that are digitally active on social media, people that are exposed to unsafe food from roadside eateries, busy market, people that lack awareness of proper food handling, affordable water purification methods, people that face environmental risks, poor waste disposal, and the likes. And my proposed solution, which is Project Typhoid Free Nigeria, is to create an online awareness series. This series is going to deliver practical and easy to understand education about proper food handling and simple and affordable water purification. Also, the importance of maintaining a clean environment to reduce typhoid risk, because the goal is to create a behavior change, a shift that breaks the transmission cycle of typhoid. And when you break the transmission cycle, it helps in preventing it. So my yeah, I can. So I spoke about my project Typhoid Free, creating an online awareness series about food and proper food handling, simple and affordable water purification methods, and also importance of maintaining clean environments to reduce the risk of typhoid fever. Actually, very scalable and yeah, very scalable and shareable, because you can share it among people. So my implementation plan, that's the next slide. My implementation plan is to conduct a brief online survey first, then develop my content, then have them reviewed by experts in this field, then launch my project on the Global Give Back Day. Then I have to share them in phases over several weeks. That should be a period of 2 weeks. Then after that, conduct a follow-up survey to know how much knowledge people have gained about this, and how it has affected their lifestyle. So my expected impact is to empower young people to take simple and powerful measures towards typhoid and to also shift their behavior. I'll be measuring my success through the number of engagements. And in the long term, I envision to scale this project into a more impactful one, to train young people in batches over a period of 12 months, if possible, on comprehensive typhoid prevention and including antimicrobial resistance and vaccine awareness. And I'll also be conducting physical outreaches to educate social and school children, food vendors, and also organize community cleanup to help the online awareness skill. And also, I'll be using my social media to share this among people and collaborate with peers. My team has the expertise of Dr. Mrs. Ajakai, who is a public health expert. Thank you so much for this opportunity, and I'm grateful to reach for this opportunity. Over the program, I was able to learn more about media literacy and misinformation, about science communication, and this is going to help me in carrying out my projects for you. And also, I learned about earth literacy. Thank you so much for this opportunity.
Thank you so much, Precious. We're so excited for you to implement your project, and thank you so much for being here today to share with all of us. So next up, and last but not least, we will have Alina share her project. So go ahead and screen share when you're ready, Alina.
Hi, everyone. My name is Alina Wilson. Thank you so much for allowing me to present today. I will be sharing a bit about my REACH project, HPV Vaccine Awareness in Queer Men and DC, my experience with the REACH program, and my interest in public health and advocacy. First, to share a bit about myself, my name is Alina Wilson. I'm currently a global health consultant at the Global Financing Facility for Women, Children, and Adolescents at the World Bank, and I'm passionate about global and community health. I'm a certified community health advocate with an honors degree in human biology from Stanford University. I've experience as a COVID-19 contact tracer, vaccine outreach coordinator, and vaccine advocate. I'm proud to leverage my experience as a REACH Young Leader to bridge the gap between public health systems and the communities that are often overlooked. Next, a story and a question. After I had the wonderful privilege of attending day one of the REACH Young Leaders workshop, I went straight to brunch with my brother and his husband. I was still thinking about HPV. The workshop covered it in depth, and it's also a key focus for my work at the World Bank. So I brought it up. That's when I learned that my brother-in-law had never been vaccinated for HPV. Raised Catholic, his parents had never mentioned it. And as a queer man living in DC, no provider had ever offered it to him, which led me to a central question that you see here. Which communities are often overlooked in HPV vaccination advocacy efforts? Too often, it's queer men. Although queer men face up to 17 times the risk of HPV-related illnesses like anal cancer, they are often left out of public health messaging about HPV. This has had a severe effect on HPV vaccination efforts in this community, and although few studies have looked into this problem, available data from one nationwide study indicates that 30 to 38% of queer men have received any HPV vaccine doses, though this number varies by age group. This is well below the Healthy People 2030 target of 80% of adolescents having this vaccine. This disparity is driven by misinformation and, as was true with my brother-in-law, a lack of provider communication and culturally resonant messaging. My target audience for this project is young queer men ages 21 to 35 living in Washington, D.C. Prevailing social norms in this community often downplay HPV's importance within this community, but data shows that changing social norms can increase vaccination rates in this population. This project aims to meet queer men where they are through community-centered outreach with the goal of shifting norms around HPV awareness and increasing vaccine uptake. Partnering with Whitman Walker, more on this community partner later, will facilitate direct access to vaccination for attendees and their networks. More on my project idea, I will partner with Immunize DC, a local vaccination advocacy organization, and the Whitman Walker Clinic, a local clinic that provides LGBTQ patients with culturally responsive care, to share accurate vaccine information through a week-long social media campaign. A social media campaign will have the added benefit of leveraging the existing social media platforms of my partners, hopefully reaching queer men who are responsive to health messaging, but may not know of the HPV vaccine's benefits. I will then host an in-person event at As You Are, a local queer community center and cafe in Washington, D.C. The event will feature a culturally responsive presentation on HPV risks and vaccine benefits, along with printed materials. An LGBTQ-friendly provider provided from Whitman Walker Clinic will host a Q&A session, and resources on how to get vaccinated will be provided. Next to my next steps and takeaways. Next steps for this project include finalizing community partnerships and developing outreach materials. I'm currently coordinating with Women Walker's outreach team and will also reach out to Immunize DC and the venues As You Are to secure event support and a date. I'll leverage partnerships with Whitman Walker, Immunize DC, and As You Are to co-host this HPV vaccine awareness event tailored to young queer men in DC on Global Give Back Day, August 9th, alongside a cohort of youth leaders around the world and other REACH program leaders. After the event, attendees will be invited to complete a feedback survey to assess knowledge gains, vaccine intentions, and opportunities for improvement. I want to thank the REACH community team very sincerely. Through REACH, I strengthened my community engagement skills and learned how to design culturally responsive, measurable health interventions. This experience has reinforced my commitment to a career at the intersection of public health and policy and connected me to a network of young leaders navigating public health work in a very turbulent political climate. This fall, I will be pursuing graduate school at the London School of Hygiene and Tropical Medicine as a Marshall Scholar and will continue to study infectious diseases and public policy. Here are the studies cited in my presentation. Happy to share more if helpful. And thank you all so much for your time today.
Awesome. Thank you so much, Alina. That was incredible. And we just continue to be blown away by the three of you, by all of the girls in this cohort. You guys are so passionate and so bright, and it's just so inspiring to hear the work that you're all undertaking. And we're so immensely proud of everything you guys have already accomplished and can't wait to see what you do next. So I'm going to go back to the slide here, and Wimboy is going to briefly share some of the data that we gathered from the REACH program and its impacts.
That was such great presentation from our three community health advocates, Sin and Girl, and just get the confidence to be here today to present y'all. It's just, I'm about to cry. They did so well. But we had about 50 girls apply to our program, and from 12 different countries. We did a pre-survey and a post-survey, and I'm a data and numbers person, so I thought it'd be, interesting to share numbers to just see the impact of our program. 62.5% of our youth advocates who are affiliated with organizations the program. 100 of the girls who completed the program would recommend the program to their peers, which I think is like shows that they were really involved and liked the program. And then 75% of the girls will continue to the implementation phase. We had them design a project with 75 of those girls would actually implement it. We had a jump from 81% program to 91% when it came to capitals leading the projects. These numbers are incredibly high because we did recruit from Women Acquiring Nations cohort. A lot of those girls from that cohort are already very involved in youth affiliated organizations, have done some form of community service, have leadership roles. And so the jump still was significant. We used HPV as our case study, and so it was really interesting and great to see that the confidence and understanding HPV grew from 65.5% to 84.5%. And also the vaccine as well, that had probably the highest jump from 56 to 87. a lot of the girls, believe that their voice matters, which is really great. So pre and post survey didn't really change much with that. But we also taught them how to identify health misinformation, and the numbers also grew there. Um, and the confidence in finding health credible information rose drastically too. So these are just kind of our numbers with a rich program. And over to you, McKenna.
Thank you. Oh, I'm missing a picture here. So of course, the main thing that we've been trying to implore you all to do throughout today's presentation is to support young leaders and support their advocacy work. And if any of you are as inspired by our Reach leaders as we are, then we need your support to help them facilitate these incredible projects. So we have two asks for you. The first ask is that we are seeking micro grants for our Reach Young leaders to be able to implement and expand their projects. We're hoping to provide grants of up to $500 for these girls to implement and expand their projects in their community. And the three girls we heard from today are only a few of our Reach leaders who are going to be implementing projects in their community. More of our incredible girls have awesome projects in the pipeline that we need support to help them to implement and expand. And the second ask we have for you is just your mentorship and support. You all got to see how incredibly bright and motivated and passionate these girls are. So if any of your organizations have opportunities like internships or volunteer opportunities or fellowships that could be a fit for our girls, or any other way that you could collaborate to help them develop and build their advocacy skills and really put their incredible skills forward to make a difference in their communities, then we ask you to please reach out to us. We have our Reach email on the next slide. So if you're interested in supporting this program through a micro grant for one of our leaders or through a mentorship position or any other position for our girls, please, please, please reach out. Or if you're able to connect us to anyone who you think might be interested in supporting. And then we also have our GAIAC information here as well. If you know someone who would be a great fit for the GAIAC Young Leaders program, please send them our way as well. I know we're a couple minutes over time, and we just wanted to say thank you so much to everyone for attending today, listening to our presentation, for your thoughtful consideration of how to get youth involved in your work. And thank you so much, Marissa and Sabin, for this opportunity to share our work with everyone. We're really grateful to have had the chance to do so.